Spondyloarthropathy or spondyloarthritis is the name given to a group of inflammatory joint conditions which can cause pain, swelling and stiffness in your body's joints and tendons. Spondyloarthropathy is an autoimmune condition, which means that for some reason the body has started attacking itself, causing the immune system to be overactive. Spondyloarthropathy may affect joints you can easily see, like in psoriatic arthritis, reactive arthritis or arthritis associated with inflammatory bowel disease. The spine may also be affected, like in ankylosing spondylitis. In some cases, both the joints you can easily see and spine are affected. People who have been diagnosed with spondyloarthritis are usually managed by inflammatory arthritis specialists called rheumatologists, like me. This video will tell you about spondyloarthropathies, the symptoms associated with these diseases, and the options for treatment. The symptoms are usually of pain, swelling. They often develop in early adulthood between the ages of 20 and 40 and are caused by inflammation in the body's joints and tendons. Sometimes this inflammation can cause a whole finger or toe to become inflamed and look like a sausage. This is called dactylitis. Tendons can also become inflamed where they attach to a bone, and this is called enthesitis. The most common sites for enthesitis to occur is around the hip, the knee, the heel and underneath the foot. Occasionally the inflammation in the joints and tendons may be severe and make it difficult to complete just your activities of daily living, such as washing and dressing. Sometimes spondyloarthropathies are linked to inflammation in the eye, which can cause pain, redness and changes in your vision. This is called uveitis. These symptoms can come on suddenly or gradually over a few days, and it can cause permanent damage to your vision if left untreated. If you developed these eye symptoms, you would need to seek urgent medical attention through either your GP emergency eye appointments or your local emergency department. Uveitis can usually be managed with steroids under the care of an eye specialist called an ophthalmologist. Having inflammation in the body can also cause general tiredness, which does not get better with rest, and having low energy, which can make it difficult to complete activities that you would usually be able to do, and that can cause problems. Spondyloarthropathies are linked to a specific gene called HLA-B27, and having this gene means that you're at a slightly increased risk of developing a spondyloarthropathy. However, many people with this gene, around 1 in 12, have this gene without ever being diagnosed with a spondyloarthropathy, and people can have a spondyloarthropathy without having the HLA-B27 gene, so it's not a perfect test. Although all spondyloarthropathies have these features in common, there are some things which they are specific to each type of individual condition. We'll discuss these now. First is ankylosing spondylitis. Ankylosing spondylitis is the most common type of spondyloarthropathy. It mainly affects the back and causes inflammation in the spine, leading to back pain and stiffness, can affect the joints you can easily see, such as ankles and knees. Ankylosing spondylitis often starts in people who are in their late teens or early 20s. It's much more common in men. In rare cases, some of the bones in the spine may link up and become fused together. This makes the spine less flexible. In serious cases, this can cause the spine to change shape and curve forward. And you can reduce the risk of this happening by keeping as active as possible and as fit as possible and having effective medical treatment. To psoriatic arthritis. Psoriatic arthritis is a spondyloarthropathy which is linked to a skin condition called psoriasis. And that causes dry, scaly skin, which commonly affects the scalp, the elbows and the knees. Psoriatic arthritis usually affects joints you can see, like the fingers, knees and toes, and occasionally it can cause inflammation in the back. About a third of people with psoriasis, which is the scaly skin rash, will develop the psoriatic arthritis, and some people may even develop psoriatic arthritis before they develop the skin rash. In even rarer cases, some patients have psoriatic arthritis without ever developing any obvious psoriasis. Psoriatic arthritis can affect the fingernails and toenails, causing small round indents to appear. This is called pitting. It can also cause the nails to become thicker and change colour and lift away from the finger and the nail bed, and this is called onycholysis. If you have severe psoriasis, you may need to be referred to a skin specialist called a dermatologist for additional treatment. Reactive arthritis is another type of arthritis, and it's a spondyloarthropathy which develops weeks after you've had an infection elsewhere in the body. Common infections which can cause a reactive arthritis are tummy bugs, urinary tract infection, throat infections, or sexually transmitted infections. A reactive arthritis can affect people of any age, including children, but it usually affects younger adults. The most common joints affected are the knees and ankles. Unlike other spondyloarthropathies, reactive arthritis usually only lasts for a short period of time, usually 3 to 12 months. However, some people have symptoms for much longer than this and can have flares of inflammation for quite a while and for many years after the first condition starts. Enteropathic arthritis is another type of spondyloarthropathy, and this can occur in people who have an inflammatory bowel disease such as Crohn's disease or ulcerative colitis. Enteropathic arthritis usually affects joints you can see, like the fingers, knees and toes, and occasionally it can cause inflammation in the back. Some patients may find that their joints become more painful at the same time as their bowel symptoms get worse and they flare together. Patients with enteropathic arthritis are usually under the care of both bowel specialists called gastroenterologists and rheumatologists who look after the joint problems. We diagnose spondyloarthropathies by, if your GP thinking of it, you may have any of these types, you get to refer you to a rheumatologist like me, and we specialize in these conditions and make the diagnosis. The rheumatologist will make the diagnosis by asking questions about your symptoms before examining you and do some blood tests and possibly x-rays and other imaging to help, such as MR scans or ultrasound scans. The treatment for spondyloarthropathy is not curative, so we don't cure the spondyloarthritis, but we can control and improve symptoms. And with the right treatment, you can have a reasonable quality of life and very well controlled disease, helping you live a normal life. The exact treatment depends on how extent of disease and the diagnosis and severity, but the general principles are usually the same, and they are the following. Firstly, exercise. Regular exercise will improve pain and stiffness, so it's important to keep moving, especially with back problems. Swimming and hydrotherapy are especially beneficial. Physiotherapy being next with occupational therapy and podiatry. Physiotherapists will give you advice about different exercises to help improve your symptoms. An occupational therapist will be able to assist with hand strengthening and basically can cover advice on individual devices like jar openers, easy grip utensils, walking aids, etc., which can help make you do tasks easier and make your mobility and ability to do things at home better. A podiatrist will be able to assist with foot care needs and advice on special insoles and other supportive footwear. Next we come to medications, and these include anti-inflammatory medications like naproxen and ibuprofen, which can help reduce the pain and swelling in the joints. They must always be taken with food to reduce the risk of side effects, especially to your stomach. Steroids can also be used to reduce pain and swelling. They can be given as tablets or as injections, and they're not a long-term treatment. They can cause complications like weight gain, high blood pressure and bone thinning. In most cases, neither anti-inflammatory medications or steroids will be enough to control inflammation in the long term, and this means that medicines which suppress the immune system need to be used. And these are called disease-modifying antirheumatic drugs, or DMARDs. They're a group of medications which can be used to treat the spondyloarthropathies which cause symptoms in the joints you can see, especially if they've got peripheral disease in the hands, knees and feet. They reduce inflammation and work very well for many people. But people with more severe inflammation or people with inflammation in their back may need a different medications which we call biologics. Biologic medications also suppress the immune system and are mostly reserved for patients who have severe disease, and they're mostly given as injections, but some can be tablets, and it can take a few weeks up to a few months for them to work, so they do not work immediately. So it's important to continue taking them even if you don't feel the effect immediately after starting. Your rheumatologist will speak to you in detail about which medication is the best option for you, as most patients have very different disease. Very rarely, the inflammation can be so severe that it permanently damages your joints and tendons, and this happens and your symptoms are severe. A joint replacement or tendon repair operation may be considered. In summary, for the majority of people diagnosed with a spondyloarthropathy, they will have the condition for life. However, for most people, their symptoms can be controlled and they can be improved with treatment, leading to a normal quality of life. If you have any questions about your condition, please speak to your GP or your rheumatologist. Thank you very much for listening.